What I'm giving out today that we're going to do is a questionnaire called Stop Bang. And it's a good tool to use to evaluate if you have a condition called sleep apnea. Okay? And if you have sleep apnea, I'm going to explain today a little bit about what it is. I'm going to break it down and make it plain. They might have told you that sleep apnea means that you stop breathing. That's only part of the equation. Why does it matter? The number one thing we need in life is what? Oxygen. Oxygen is life. If you oxygen, for instance, you're out in the oceans and you get under that water, or somebody puts your head under the water and they won't let you up, you start wiggling and fighting. What you're fighting for is air. Air carries the oxygen, which we need. And we need oxygen for our brain, our heart, and pretty much every organ in our bodies. Now you say, well, okay, we all know that, right? So where does the sleep apnea comes in? We get our oxygen circulating from a pump in our body called our lungs. Our lungs, this is the heart, and then the lungs, let me get someone to stand up. Can you get someone to stand for me? I want to show you. Most people take it for granted, but in your body, your heart, side, we have a couple people, rare people have it on the right, but it's usually right here, the left, but that's almost false. The heart actually, if you take your fist and put it in the middle of your chest, it really starts right by that breastbone. And it's under the breastbone, and it's covering the majority in the left side of your chest. And the purpose of the heart is to pump blood, right? We know that. But what you don't know, and most people don't talk about, is the lungs. On either side of the heart, here and here, underneath the breast, underneath the ribs, are the lungs. I'm gonna have you turn around. And the lungs go from the top, up here on your shoulders, all the way down to here. It goes right underneath your breast area. So it's a pretty big organ. Thank you so much for our model. Thank you for our model. And why is that important? The lungs take oxygen. So blood goes to the heart, goes to the lungs, picks up oxygen, goes back into the heart, and then the heart sends that blood with oxygen all over the body. Okay? And you need two of them. Some people are going to move if they have an injury or cancer. Anybody know anybody who has only one lung? Or they might have gotten tuberculosis or had a lung disease that end up getting rid of part of their lung. So imagine this, you need two, all right? So you have the heart pumping the blood goes to the lungs give the blood oxygen, it goes back into the heart, and the heart pumps it to the rest of your circulation. So now, where does sleep apnea come in? Well, if you have a problem taking in the oxygen out of the environment and it going into your lungs, we have a problem. So what would stop oxygen going into our lungs? Yes.
I know exactly.
Tell me.
I have COPD.
So what's happening?
So that I have holes in my lungs from smoke, damage from smoking.
Oh, say it loud.
Damage from smoking
cigarettes. Smoking cigarettes.
The lungs are black. And the oxygen can't filter
through it. So she reports, you want me to share? She said that she has COPD. COPD, everyone talks about it. And the O in COPD has to do with also what happens, she said, because smoking, what the smoke does is takes the oxygen and blocks the oxygen and puts toxins in the lungs, and that toxin destroys the lungs. especially over time. Once, twice, 1 year, 2 year, not a big deal. But you do it for what should be working, now stops working. So you're supposed to have all this working, and now, and she said she has holes in her lungs. Places in the lung longer fills up with, right? Or another thing can happen. Yes? Yeah. There's another condition called fibrosis. Fibrosis, where the lung is supposed to be like nice and spongy, but then it gets hardened. It gets hard. And instead of it doing this, like the heart does, like a blues, it doesn't fill up as well because it can't even move because of a condition called fibrosis. Okay, and there's some autoimmune conditions like scleroderma that can cause the lung tissue to get hard. What's an idea? Think of a sponge. You ever have a sponge and you soak it in water or you wet it and it fills up? That's like your lungs. Your lungs is like a sponge that fills up with water. Now what happens when you squeeze that water out and you put it on the windowsill or leave it out? What happens after a while? It dries out. And then when you go to hold it, what is it? It's hard. That's the lungs as it gets damaged. It gets very hard. Would you ever have a sponge where part of it's wet and part of it is dry? Okay, that's when part of your lungs become damaged. Some part of it still can absorb the water or the oxygen, and another part no longer absorbs anything. In fact, it's just sitting there being useless. And if you have a sponge long enough, you can actually break that sponge once it dries out, right? Yeah. And it's useless. I use that all the time. Just cut that piece off, throw that other bad boy, and just use the part that works. But let's go back. Yes. So your question?
Yeah.
Question. Yes.
What is the criteria? Because I know they do lung transplants.
Yes.
So at what point, when both lungs are non-functional,
yes,
and you meet the criteria to get a lung transplant?
Wow. Well, that definitely is. If your lungs are no longer working, you definitely both. One usually is removed if there's actually damage like cancer or tuberculosis that's destroyed part of it, and it's like an infection that's spreading in the lungs. They will often go in and remove it, and you can still function on one. But now when both parts of the lungs are damaged, you may definitely, to live, remember we need oxygen to live. Now you're going to have to try and get a lung replacement, okay? So my goal today is trying to get you not to the point where you need a replacement. And so, oxygen actually can be measured as saturation. They call it O2 saturation. You know when you go to maybe the doctor's office, they put something on your finger? It's measuring the oxygen in your body. You want to keep that oxygen level greater than 92. Right? You want to, ideally, the best really is anywhere from 98 to 100. You want to keep it really nice and high. This is lots of oxygen. But you'll be all right if you can keep it on. Once you get to, and you probably know, anybody would know, 87 and lower, then you're going to need oxygen. You're going to need help. And usually you'll get oxygen that you can carry around with you with a portable oxygen machine, or the big machine that you can sleep with at nighttime to give you the oxygen, because what happens when we lay down at night, it's harder to breathe. So sleeping with the oxygen at night, if your oxygen level, oh look at, man, just to show everybody, this portable oxygen machine, it gives oxygen. It's also a weightlifting device. You know, you gotta do your weights. Because it's easily...
It's better than that rolling tank.
Yes, this is easily about 10 pounds that she's carrying around with her every day. So I want you to, when you're sitting, I need you to just do some curls here, okay? I'm messing with you. I'm messing with you. It's heavy enough, but the other one is much bigger, and you have to wheel it around. And for someone who already has trouble breathing to actually be pulling something, that can be difficult. So ask your doctors if you have oxygen that's low to get you a portable. Now, there's one at night that you can sleep with. So let's go back to the story of snoring. Take a look at that paper. And I want everyone to answer the question. 1, do you snore loudly? Loudly meaning, like if you're sleeping and someone's at the door, they can hear you.
Oh, like a bed.
Yeah, like. 2, do you often feel tired during the day? Theoretically, you slept all night, and then you wake up, and instead of feeling like, yes, life is good, let me get going, you're like, I need to go back to bed. Who said that? You feel like you still need to go back to bed. Okay? Now we'll come back to why that happens. 3rd, answer on your papers. Has anyone observed you stop breathing? No. Like Carter might say, here, remember I told you about the... No. Okay. Answer yes or no for that. Are you being treated for high blood pressure?
No. Yes.
Okay, right. Put a yes next to that one.
Yeah.
Because the combination of having high blood pressure and problems breathing can cause a condition, sleep apnea. Next thing they ask, is your body mass greater than 35, the BMI? How do you know? If you're over 200 pounds, you probably have a BMI over 35, especially if you're only 5'2". Okay? All right, next one they ask, is your neck circumference? When they measure your neck, is it bigger than 40 centimeters? Okay, so if you have a big neck, why does that matter? Because the bigger your neck, guess what happens on the inside? This is your neck. Now, if your neck enlarged, what do you think is enlarging with? Fat. Yeah. So you're getting an enlargement, and guess what is going to have difficulty? Your neck, your esophagus, and your trachea starts to get squeezed and becomes what we call narrow. I just found out, I went to a seminar this weekend. I was there from Wednesday to Sunday, and I did not know, but did you know that as you gain weight, do you know where the first place you gain weight? Not the sexy belly, no. You start getting it in the butt. So, how many say the butt? How many say the gut? Your face. First place, the face? I found out. I always thought it was around here, because you can always, when you gain weight, you can, or your face, ooh, your collarbone. My mom uses a collarbone. If she can't see my collarbone, she says I'm gaining weight. You ever been told your collarbone? I can see your collarbones. That means you've lost weight. I found out that your tongue is the first place that weight gain begins. Wow. And the 3 parts of the tongue. You got the front, right? That's not where. It's not the middle part. It's the back of the tongue. You gain weight at the back of the tongue. I was like, what? So that's why you start hearing people snoring. Because remember, oxygen is going through your mouth, it's going through your nose, sideways. That's your eyeball. There's your mouth. Right here in your mouth at the back, this area right here at the back of the tongue, it allows oxygen supposed to be going down. But if your tongue has gotten bigger because you've gained weight, it's going to block the entrance to the lungs. So if everybody can do it right now. You could try to breathe through your mouth now, right? When your head's like this, right? You can feel the breath going in and out with your mouth open. Now, tilt your head back. Your tongue falls to the back when your head's elevated, like on a pillow. But if that tongue has gotten so big because you've gained weight, you're now going to block the back of your throat. The other thing that can block the back is your thyroid. If your thyroid, like you have thyroid disease, your thyroid's big, you've gained weight and your tongue's big, then you have sinus problems, right? So your nostrils are blocked with boogers and polyps, you know, or mucus. Oxygen is going to be very difficult going through. It's like going through an obstacle course. Got to pass the boogers, I got to pass the tongue, I got to pass the thyroid. And so what should be 100% of the oxygen going down your throat, you're now getting to numbers like 87, and it's diminished. So first thing we can do is what? To get rid of poor oxygen loss. What can we do? If number one is lose weight. Lose weight. So naturally is lose that weight. No medicine here. Lose the weight. How many people have had problems breathing or short of breath and they lost a little bit of weight? Anybody lost weight? Did you find your breathing was a little better once you lost a little? Did you notice it?
That's because I was in the hospital.
Oh, she had the hospital diet.
No, since I've been out of the hospital in 3 weeks.
Yes.
I lost 5 pounds on my last appointment.
And how's the breathing?
So I'm down now 20, but my breathing can't get better.
Well, don't believe the hype.
Okay.
You keep going. You still smoking? Uh-oh, she got busted. She's still smoking. She busted.
Oh, but you know what? Who said that? Me. Okay, see?
Yeah, she's
That's a limit.
Oh, she's getting busted up again. Your teammates are busting you up.
I'm not smoking as much as I used to. That far.
Diminishing her smoking.
I've been smoking 50 years. 50 years.
Amen.
50 years. Can you go back 50 years?
And guess what?
Oh, it ain't easy.
And praise God. Guess
When I
what?
start smoking cigarette, it cost 15 cents. Come on, baby.
Okay, tell me where you're down
What
to
else
now.
I know?
How much you down to now? Tell me,
How much do I know?
Good.
Okay.
How much you down to now?
What? Cigarettes?
How many a day?
10.
10? All right. How much come in a pack?
20.
All right. She's at 50%. So we got to give her a hand for that. Come on, guys. She's right. 50 years is hard, and now she's down 50%. All right. We're making a win. We got to make everything a win. And the next time I see her.
Remember when you came?
Yes.
What was the first thing I said? What I'm going to do this year, my pledge to myself, is doing better with my health.
And you're doing it.
Okay.
50% down. You're doing it. That's it. We're on our way.
Okay.
We're on our way. If we can lose 50% of the weight we need, say, look, you're 250 pounds. I need you to drop to 230. I don't want nobody over 200 personally as a doctor, you know, because I know there's a lot of complications that come with it. But breathing complications, because the weight that you get at the tongue, we said, blocks the throat. But what also happens, if you ever lay down, you ever lay on your bed and feel like you're suffocating? The weight on the belly pushes up against your diaphragm. That's the band that separates your belly from your lungs. And that weight pushes up against that band. And instead of your lungs being this big, because it's being pushed, it now is smaller and you get less oxygen. So the less pressure on the diaphragm, the more the lungs can expand, which means the more oxygen they can get, right? So our goal is to lose, first thing, the cheap weight, to get rid of this lung problem. The second thing is what? Any ideas? What are the cheap things we can do to help our oxygen? What else? Exercise.
It is National Walking Day.
It is?
Yes.
So exercise, and we're talking nothing strenuous, walking slowly, nothing fancy, even with the oxygen, nothing fancy, causes you to do it. Breathe. But while you're walking, I want you, if you want to improve your lung capacity, I want you to take deep breaths. Breathe, you know. Stop the sippy. What I mean by that? Most of the time we're sitting here and we're doing this. That's called sip breathing. You want to breathe with a deep breath. Like you're sitting in a chair right now, everybody take a deep breath in. And you want to feel it full up. You want to feel the fullness, not sippy. Breathe deep, and then you release. Try when you take that breath to hold it for like 2 seconds, and then release it. Okay? Do it while you're sitting, but then when you're walking, really focus on your breath as you're walking. Nothing fast, just breathing to increase circulation. Remember, circulation carries the oxygen. right? So as you improve exercise, now say you've been walking, you've lost the weight, and you still can't breathe at 87. What kind of things do physicians have to do? We gotta know, is it really COPD? Is it sleep apnea? Or is your throat blocked? We have to examine your throat. So your doctor may ask you, or you may ask your doctor, can you send me to an ear, nose, and throat specialist? So they can look at the back of my throat. Because you might think that, you know, it's your lung problem, but it may be a throat problem. Maybe your tongue is blocking the air, okay? Maybe it's a nose problem. Remember I told about those boogers of mucus? Maybe you have something called polyps in your nose, the little grapes that block the flow, and then you can treat it. So if we can treat the blockage, open up the back of your throat as a surgical procedure, or remove the polyps in your nose, do it so you can breathe. Don't be afraid. Get the polyps out. Ear, nose, and throat specialist. And also a pulmonologist, which is a lung. What are they going to do? What's a lung doctor going to do? There's a test that they do. Anybody know?
First of all, they have you walking back and forth and on that little monitor you can see.
And then they do the
breathing
MRI.
test. Okay,
The
that's
CT
after
scan
that.
and MRI.
After they do the breathing test, they're going to do a test called a pulmonary function test. They're going to make you take a nice deep breath, and they're going to make you blow in this device to see how well your lung is working and expanding. Okay? So get the lung test, and then after that, if there's still a problem, they're going to send you to do a scan of your lungs. They may order a CAT scan, or they may order an MRI of the lungs to see if there's any cancer, or the condition I told you about, which is fibrosis, where it gets hard like the sponge. Okay? And the whole goal is to get you breathing better. After you do all this, they will prescribe you some medication. Okay, now here's where we have fights. Who's my asthmatics in here? Where are my asthmatics? Got one. You have your inhaler with you? You do? All right.
Like I have allergies.
You have allergies.
Yeah.
Now, I have patients who are asthmatics and have allergies. And I guarantee you, 50% of the times they use their medicine. They wait until they can't breathe. They're like, I can't breathe. Then I go get the inhaler. That's not how it works. That's not how it works. Well, I like being on meds. You like living. Okay? As Black people in America, we are still dying from asthmatic attacks, which we should not. We left the nebulizer at home, or it's in my job in the drawer, but you in Orlando. Okay? Your breathing machine needs to first be with you. Now, there are two types of machines that got inhalers are going to give you. One will have a steroid, and one, they call it albuterol, right? It's called what we call a beta, right? The first step is to use this one. The albuterol opens up the lungs. So remember what I'm saying to you. We're supposed to be doing this with our lungs. But if you have trouble breathing from allergies or COPD or any other breathing problems, instead of doing this, it does, which means you don't get much oxygen. Well, before it does this, you need to use your inhaler, right? The albuterol is called your rescue medication.
This is my albuterol is my
Rescue.
emergency.
There you go, your rescue. So if you're feeling short of breath, you go around somebody with too much perfume, you go outside and all the trees and the pollen's getting to you, you know you're going out there, you know you have allergies. Use your inhaler 30 minutes before. You know you're going to exercise, and every time you do that aerobics class, you feel like you're about to pass out. Use your inhaler 30 minutes before. Now, What if you're not doing aerobics? What if you're just sitting watching TV and 3, 4, 5, 6 times a day you're having to use the inhaler? It's not working. Now you go to a steroid inhaler, because now you need to reduce the mucus and the junk that's lining the lungs, and that's a steroid inhaler. That's not waiting for emergency. That's wake up in the morning and use it, dinner time you use it. Don't wait for symptoms. Morning and dinner, morning and dinner. Then if you feel tight, you go to the albuterol, okay? But don't leave it at home. Take it with you. Make sure it's in your pocket or your purse or somewhere close. Because let me tell you, I've heard too many people who've died just because they couldn't get to their inhaler. Okay? So please, 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 yes.
I have the allergy. I did have allergy, and I had to go to the doctor for that. And he put some medicine on a long stick, and he stuck it out my nose. And I've been doing well ever since then.
Wow. That was an ear, nose, and throat specialist?
He was just a doctor. I don't know what he was.
Okay. So go through the steps to improve your breathing. Now, if you're snoring, so you've gone to, you lost your weight, you've been exercising and walking, you went to the nose doctor, he said you don't have any polyps, you went to the lung specialist, and he said, yeah, you got a breathing problem, but you don't have cancer because they did the scan, and now you're snoring at night and you're about to lose your family and friends because nobody wants to live with you because they can't get any sleep. They're sleep deprived. They're going to recommend you to get a machine called CPAP. It's a machine. Anybody have one? Okay. Come tell us about the machine. Tell us about the machine. Why did you get the CPAP?
Sleep study.
And what they found?
They said I would stop doing that.
Okay. And how did you feel in the day before you got the machine? You feeling tired?
No.
Okay. So you only stopped breathing?
Right.
Okay. You didn't get any chest pain or anything?
No.
Okay, good. So his only symptom was not breathing. So then they recommend you get this machine. Describe how the machine looks.
Like an alien.
Gas tank.
Like an alien.
Well, let him talk about his machine. Go ahead. Tell us about the machine. So he says, so it goes over your eyes too? Okay, so it just goes over your nose and your mouth. And you put it on at night?
Yes.
Do you have to strap it on?
Yes.
Okay. And so, how does it feel? Is it uncomfortable?
Yes.
Yeah. Do you wear it every night?
No.
He's honest. And I get it. How long have you had it now?
About 2 years.
Okay, 2 years. There are new ones now that have gotten smaller. Tell them to get your new one.
I tell the VA.
Yeah. So now that but when you do use it, right? Does it help you breathe? Do you notice any difference?
No.
Are you still snoring?
I don't know.
Don't know. Anybody around you tell you you're snoring?
She know.
Is she still snoring
Yes.
with the machine?
No. Oh no, not with the machine.
Okay, so since he wore the machine, he's not snoring?
No, it's just a machine now.
Then thank you. All right, so all you engineers out there, I'm calling y'all to task, although there's some new machines. You need them to stop looking like an alien. Second, they need to get quiet because we already couldn't sleep because of the snoring. Now we can't sleep because of the machine making all the noise. Okay, so we need some technology, to work on sound and cuteness. We need it to be a little cute. We need to be something about this big or something that you put on your nose like a breathing strip. Okay? But either way, the purpose of the machine is to give you oxygen, because without oxygen, although we're laughing and talking, when you don't have oxygen going to your brain, you can have a stroke. When you don't have oxygen going to your heart, you can have a heart attack. And you can have both. You can have a stroke and a heart attack because you don't have enough oxygen. So it is a very serious thing. So all those who did the questionnaires, take this to your doctor and let them do the investigation to find out if you do have sleep apnea, because not having oxygen as humans, we need that. So evaluate if you have sleep apnea. Yes?
I have this, the CPAP at home as well.
Yes.
My mom has that. She had that house too. But the one that they use at the hospital is a BiPAP. It's more intense than the one that you get at home.
Right.
It gives you more pressure
Yes, they force more oxygen down your throat.
than CPAP.
That's the BiPAP. You don't want to get to the hospital from not breathing. It's not pretty, yes.
Okay, Dr. Powell,
Yeah.
the VA did a surgery on me for my lungs. That's why I know about the test, because I have to take that test. But I don't wear it no longer because after I turned 65, I could no longer go to the VA. My husband was a vet. But they went through my ribs, cut through my ribs for this, to see why I was breathing. Well, I had this cough. So they was wondering why I was coughing. And I'm like, well, I ain't started coughing till I found this man had took all my retirement money.
Took her retirement money, then she started coughing.
I started, when we got a call that we had went an investment in Palm Beach County, and he ripped out a whole lot of people. When I found out that, I started this cough. But the doctor said he seen that it triggered something else. I said, no, man, I ain't started calling this man. I found the man took all my money and I went off.
Stress.
So I was doing good. So then he said, oh, the VA started doing me for COPD. First they said I had it. I'm like, man, I don't smoke. I try not to be around people who smoke. So then it went from there. He said, you had asthma? I'm like, yeah, but I hadn't had an asthma attack in a long time. So then they went to some kind of, it's not pneumonia, but something in that area they want to say I had that. They went from there to saying I had pulmonary fibrosis. That's the last thing they said I had. So they did this test. They went through my ribs. I probably had 3 incisions. That was the last of like 2020. They went through my ribs. After they went through my ribs, I say, I told the doctor, I'm like, you told me 3 incisions, I had 5. But in me, I'm still not completely healed from it. Right. So on my right side, if I lean over, I was having a hard time. So I say, well, since y'all did the surgery, I'm more short of breath than I ever been. Wow. I said, what did y'all do to me? Because first of all, I could run upstairs. They did the stress test. The doctor said I did my stress test better than he could. So I'm like, now it's like I'm at a standstill of stuff that I used to do because of the surgery they did. I mean, I'm saying, y'all just screwed me up. That's all. And so now.
So that's a good point. What she's explaining is that she had a procedure where they put it in, they do a chest tube, and they do a pulmonary wash. They take out the fluids out the lung because they're trying to find if there's a bacteria in there or a virus. Tuberculosis is one of the more complicated. So they'll go in sometimes and take out fluid, and that fluid they test. The procedure, it is a procedure, and when you open up, you have to go through the ribs, you have to go through the muscles, and then you go into the lungs. So you're going through 4 layers to get to the test for the lungs. So that's why, let's start at the top. Let's start at the top, and if we have to get organ transplant, as the young lady spoke about, that's at the end of treatment. But on the preventative side, if you can help your breathing through your exercise, your walking, using your inhalers twice a day on the steroid for rescue with the albuterol, treat your allergies. We in spring, it happens every year, okay? So don't be surprised when you start getting the burning eyes, the runny nose, the scratchy throat.
That's me.
It's allergies.
Especially at night.
Yes. Take your medicine. Do your nasal rinses with the saline to wash out the excess dust and dirt that gets in there throughout the day. And if that doesn't help, you can take an over-the-counter antihistamine. I'm not name branding, but there are plenty out there. Generic works. I already told you about spending your money, right? Don't go with name brand if you can do a generic. It's the same thing. And don't take Benadryl in the day because it's going to make you sleep. Okay? But do your nasal wash. Take your inhaler. And if you know it's high. Like, for instance, when it's very windy, it's worse because the wind travels and throws stuff around. Don't go out there if you're asthmatic, if it's windy, or if you have allergies. Wait till the wind dies down. If they're mowing the lawn, don't go out there because the grass will aggravate your breathing and your sinuses. So these are just preventative things that you can do to help take care of yourself. But please, work on the oxygen, work on the breathing.